Welcome back to The Price of Business. I am your host, Kevin Price, talking to you about you and your business. Geetinder Goyal, he's a regular contributor on The Price of Business. His practice is OurWayHealth.com. And we're now beginning a series of programs about ways that businesses and individuals are using to help save money when it comes to their insurance costs. And to both Geetinder and I, we both thought it was completely logical to start with those who are using self-insurance as a way to kind of control their financial destinies. And so we're going to focus on that here in our first in the series and many more in the series as well. Before I do that, though, Geetinder, why don't you tell us a little bit about OurWayHealth.com, which is your practice?
Absolutely. Thank you for having me again, and welcome to Mike this morning. So our practice is Our Way Health. It's a direct primary care practice, which is based on a retainer monthly fixed low-cost membership instead of insurance. What we have done by that is removed all barriers to access of care for our patients, reduced the total number of patient panel that a physician carries to about 400 and 500 patients, freeing up time for our patients. We believe that a family care physician or a primary care physician needs to have time with our patients to turn our healthcare statistics in our country around.
Yeah. Yeah, and that's why, to me, it made really perfect sense to explore other areas that are savings oriented, and self-insurance to me is so logical because one of the underlining, there's two primary objectives what I can see from self-insurance. The first, being and really, I say the first, it's really not in this order. It's really equal. One being the protecting of the bottom line, the financial bottom line of the company. And the best way of doing that is through the second part, which is helping them, really maintain healthy employees by creating a culture in which they have a lot of responsibility and opportunity to control their health. And Mike Ferguson, president of the CEO of the Self-Insurance Institute of America, which is SIIA.org. Mike, welcome to the program. Did I do a fairly good job talking about what self-insurance objectives are?
You did a great job. You teed things up very nicely.
And talk a little bit about how they do that for business owners.
Sure. Self-insurance is basically, it's an alternative. It's what we call an alternative risk transfer strategy where, a traditional insurance strategy. And we'll start off with talking about healthcare, although you can utilize self-insurance for other types of business risks. And you can tell me if we want to branch off into that conversation. But just to start in, if you are an employer and you want to provide health insurance benefits to your workers, you have two options. Option number one is you purchase an insurance policy from a traditional insurance carrier like a Blue Cross, a United, those types of companies, and you will pay a fixed premium to that insurance carrier, and in turn the insurance carrier will pay the claims of your employees as they're incurred. And certainly there's nothing wrong with that, but there are a lot of companies out there, especially almost all large companies and an increasing number of small and mid-sized companies that said, you know what, I think we can do this a little bit better. I think instead of paying out a fixed fee to an insurance company, we think that we can cover those costs ourselves. We can essentially pay for it ourselves, self-insure, and save money and have the opportunity to customize the plan that best meets our workers. And so collectively right now, what people don't realize is how prevalent self-insured health plans are in the marketplace. There are about 100 million Americans that get their benefits through self-funded health care plans, and those numbers add up. There's a large chunk, about 60 million, from private employers. We get another 20 or so that are in union plans that utilize self-insurance, and another 20 or so that are municipalities, state, counties, other municipal entities that rely on self-insurance for cost-saving opportunities and for customization advantages.
Very good. Geetinder, your question. And by the way, Dr. Goyal, you also have a partner. Why don't you mention her as well?
Yes, my partner is Dr. Andrea Seifert. She is an integrated health practice physician, and she will be helping me in starting our direct primary care practice. Mike, my question to you was, when I was looking up your organization, I saw that it was started 35 years ago, and it has grown to be a large organization with members from all over the world. Share with us a little bit about why this organization came into being, or what was the vision behind when this organization was founded.
Well, great question. It was founded more than 3 decades ago, and this was shortly after a passage of some federal legislation that made it more easy for companies to self-insure their health plans. And you started to see this trend emerge where companies, and it started with the larger ones, where they were deciding, listen, we're going to go at our own, we're not going to utilize insurance companies. And then shortly after that, it became clear that this sort of marketplace was emerging. And when I say marketplace or industry, it was the employers, and then all of the what we'll call service providers or business partners for the self-insureds came into this marketplace, because when you think about it, most companies are not in the health insurance business. They're not in the business of insuring, claims, processing claims. Mm-hmm. So there's been a cottage industry that has sprouted up 3 decades ago and has grown since then substantively for companies that provide specialized services for self-insurers. The nice thing is, if you're a company and you want to be self-insured, you don't have to go it alone. There are companies there that, third-party administrators are a very common business partner for self-insured entities that administer the claims. And then you have a variety of companies that do wellness programs, technology, software type of things for the claims management. Stop-loss insurance, which provides the risk management backstop for these, financial backstop for these companies. So over time, as the number of companies started moving into the self-insurance market, there became more companies in turn that were created to service those companies, to help them run their plans more effectively and efficiently. And so because of that, sort of been a snowball effect over the last 30 years, and we find ourselves here today with a fairly large self-insurance marketplace. Mm-hmm. Yeah. And the association, in turn, is the leading trade organization that sort of organizes those that are involved in this marketplace. So SI is become extremely relevant because of in tracking the size growth of the marketplace.
Let me ask you, how big is that marketplace? Do you have any measurement? Like, how many members do you have, for example?
Well, we have close to 1,000 members across the country.
And they represent maybe thousands of businesses each, I would assume, or in some cases.
Well, our membership varies. We have members that are self-insured entities, and then we have members that service self-insured entities. So if you take collectively, we probably represent tens of thousands of self-insured plans nationwide. I don't have the exact number, but it's a pretty significant one.
Mm-hmm. Very, very interesting, Dr. Goyal.
I have I have a question for you, Mike. There is a emerging evidence, as well as a body of physicians who are embracing more of a free market concept in healthcare today. And there are several examples of them stepping out of sort of their comfort zone and start selling products directly to the consumers, which includes employers as well as individual customers. What that has done is allowed physicians the freedom to practice, have a control on their own practices, and they are able to deliver better as well as cheaper care to the employers and the individual physicians. And one of the leading examples of this is the direct primary care movement, where primary care is sort of being carved out of the insurance, making both physicians and patients a lot happier. So my question is, how can physicians like these, like me, who want to try new things to help change the healthcare, how can we work with your organization? Because I feel like an organization like yours can be a great supporter for physicians like us in helping achieve our goals. So how can we work more closely with your organization? What are the ways for us to reach out to maybe the members of SIIA in maybe our local community?
It's a great question and background that you provided, and I would agree with you that actually one of the more interesting trends that is occurring is how we would term it is direct contracting between the providers and the payers. This is one area where we see a lot of interesting growth, where self-insured employers are sort of bypassing the insurance companies and the networks in some cases, and developing relationships direct with providers, and that's been a positive for a lot of employers. There's still, which is not to say that there is a lot of very good networks out there that operate within the self-funded marketplace, and I wouldn't necessarily see the direct contracting replacing those. I think it's simply a complementary market dynamic that should be explored further. It's already being. Many of our members are already looking at that. In answer to your specific question, we'd welcome more engagement from the provider community. I've actually had some conversations just really in the last couple of weeks with some leading providers that are looking at ways to better partner with SIIA to open lines of communication to see what's possible. And I would encourage Doctor, if you and I'd like to talk offline, or we can arrange a time to talk in more detail. But we're very open to that because we think that's a useful partnership.
Mike Ferguson, he's president and CEO of the Self-Insurance Institute of America. Dr. Geetinder Goyal, he's with Our Way Health. That's OurWayHealth.com. Got to wrap it up. Great conversation. I'm looking forward to visiting with others that are working with your group. And I really want to help model this. I'm hoping that we can get your organization to provide information that I can use at usdailyreview.com that gets about 1 million hits a month, plus at priceofbusiness.com to encourage other businesses to look at this. Maybe we can get an article from you on this concept, and other content. Do you think that's possible?
Kevin, it's absolutely possible. And as I mentioned on the outset, too, is we talked about healthcare today, but there are a variety of self-insurance strategies that businesses can use for other types of insurance risks, workers' comp, property, casualty, and others, that I would love to talk to you more when we have that opportunity.
We're going to have that opportunity as well. I look forward to it. Mike Ferguson, you can learn more about him at SIAA.org, and Dr. Geetinder Goyal at OurWayHealth.com. More for you after this on The Price of Business.